Welcome to Medically Speaking, where we bring you expert advice to help you make informed decisions about your health and wellness. Today I'm joined by Dr. Olga Lemberski. She's a board-certified ER physician with Wilmington Health, and she's here to help us answer a question most of us face, which is, when do you go to the ER, when do you go to the urgent care, and when do you treat an illness at home? It's information that could save you time and sometimes even save a life. All right, I'm here with Dr. Olga Lemberski. She's a board-certified ER physician. Dr. Lemberski, as an ER medicine specialist, what are symptoms or signs that should send someone straight to the ER?
That is a great question. So when we think ER, we think things like severe chest pain. That means you could be having a heart attack, and I would go directly to the emergency room. Another significant symptom is weakness. So weakness on one side of the body, or numbness, difficulty speaking, that could be signs of a stroke, and that is an immediate indication to go to the emergency room.
And how does that differ from when someone should visit a urgent care?
So urgent cares are great resources for minor emergencies. What I mean by that are lacerations or scrapes, injuries to your ligaments like a sprain or a strain. Other things that urgent cares are great at taking care of are ear infections, sore throat, coughs, and cold symptoms. So that would be something I would visit the urgent care for. And then you can also offset the emergency room because it prevents all these patients from going to the ER for more minor emergencies.
What about common illnesses? When can people safely treat those at home?
Well, if you have a common illness like the cold or a low-grade fever, it's perfectly safe to treat your symptoms at home. Tylenol and ibuprofen work great for aches and fever. If you have a sore throat, I always recommend warm saltwater gargles. And if your nose is stuffy, there's over-the-counter saline nasal spray. Also, make sure that you get plenty of rest and stay hydrated. So water or electrolyte replenishment drinks are great for that. Now, if you have a minor sprain or a strain or a sports injury, always rest, ice, elevate, ibuprofen and Tylenol if you need it. However, if any of these symptoms are worsening or just not getting any better and it's been a few days, it's always important to get evaluated.
What about when a child gets sick? What should parents do?
Make sure the child is resting, so keep them home from school or daycare, and also watch their hydration levels because children can get dehydrated very easily, especially if they're not feeling well. So make sure they're drinking water, or there's over-the-counter pediatric electrolyte drinks. Also, use age-appropriate Tylenol and ibuprofen for fever if they're not feeling well, and make sure that they stay home until they feel better. Typically, schools want kids to stay home until they're fever-free for at least 24 hours without any fever-reducing medication. Also, we want their symptoms to be getting better and to make sure that they are feeling better. Now, very important, if they're not feeling better, or if their fever is very high, or if they're just not acting appropriately, or they're just very tired, it is a good idea to get evaluated.
Before we wrap up, what advice do you have for people who just are not sure where to go for care?
I think most importantly is if you're having significant symptoms like chest pain, which could signal a heart attack, or weakness, numbness, difficulty speaking, which could signal a stroke, is to understand that needs emergency care at the emergency room. Minor symptoms like cough, cold, low-grade fever, or aches and sprains can be taken care of at the urgent care or your family doctor's office. If you're just not sure, it's always worth a call to your family doctor's office because there's nurses who can help guide your decision on where to seek care. Now, I think the most important thing to remember, and the key, is to not delay your care for a serious emergency, but also make sure you're using the ER appropriately and not overusing it for minor complaints.
Thank you so much.
Thank you.
A big thank you to Dr. Lemberski for sharing her expertise with us today. Knowing the difference about when to seek emergency care, urgent care, and at-home treatment is key to managing your health and wellness. If you ever have questions about where to go, Wilmington Health is here for you. For more tips and resources, visit wilmingtonhealth.com. Until next time, stay well and stay informed.